Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what is the pattern of joint involvement for each of the important diseases? We have three important arthritis. We'll see for three of them. So, osteoarthritis. In osteoarthritis, proximal interphalangeal joint, distal interphalangeal joint, first carpo-metacarpal joints are mainly involved. Then what is paired in osteoarthritis? In osteoarthritis, metacarpophalangeal joint and the wrist joint are paired in osteoarthritis. Then the next important is rheumatoid arthritis. Okay, in rheumatoid arthritis, actually proximal interphalangeal joint, metacarpophalangeal joint and wrist joint are involved in rheumatoid arthritis. Then what are paired? Distal interphalangeal joint is paired in rheumatoid arthritis. Then we have psoriatic arthritis. Okay, in psoriatic arthritis, distal interphalangeal joint, proximal interphalangeal joint, and any joint can be involved in psoriatic arthritis. Similarly, any joint is paired in psoriatic arthritis.
thank you and thank you for watching.